During this video, we'll explain what's involved in a flexible sigmoidoscopy. This is a procedure to investigate and sometimes also treat problems in the lower part of the colon and rectum. The colon is also known as the large intestine. It runs between your small intestine and your rectum. Food travels through the intestines where nutrients and water are absorbed. The leftover waste becomes stool, which is passed out from your body through the anus. The sigmoid colon is the last part of the colon on the left of your body. It bends back toward the middle of the body to join the rectum. The procedure is done using a tool called a flexible sigmoidoscope, which is a long, thin, flexible tube with a camera, a light, and a channel to insert instruments. This test helps find problems such as ulcers, infection, or abnormal growths. It usually takes 10 minutes, but can vary depending on your personal requirements. You can usually have this procedure without the need for medication or sedation. You'll lie on your side on the couch. The scope will be inserted in your anus and guided through the rectum and sigmoid colon. Images will be displayed on a monitor for the healthcare team to view. Video may be recorded and photos are taken for your medical records. Air is used to expand the colon to help visualization. You may feel some discomfort, cramping, or feel like you need to have a bowel movement due to the air. The healthcare team may gently press on your abdomen or ask you to shift position occasionally to help guide the scope round tight bends. The healthcare team will examine the lining of the colon carefully. They'll look for any abnormalities such as bleeding, inflammation, infection, or growths. They're likely to take some biopsies if they see anything abnormal. A biopsy is when they take a small piece of abnormal-looking tissue and send it to a laboratory to make an accurate diagnosis. In some cases, it may be possible during this same procedure to remove any small growths, known as polyps, or stop bleeding by inserting instruments down the scope. When the procedure has finished, the scope will be removed. You may feel some gas or cramping. However, this will settle with time. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.